খাওয়াইলে এরপর দেখুন বাকি সুযোগ দিতে
Hello. Hello. Assalamualaikum. We are going to start our and the important all is identities of the complicated and emergency cases, and those cases to refer to health facilities. In most of the cases, we will have complex for biomanagement. Actually, community is a unique example for public-private partnership. And because all the community units have been established in community-donated land. For not a single community, the government has partnership. So it is actually one of the unique examples, and because land is very costly now. Initially it was a 5 decimal land, but now it requires 8 decimal of land, and for 13,500 communities it requires 700 to 800 acres of land. So huge donation from the community, participation of the community, and it is not very costly. And one thing I want to mention that in most of the cases, the land donors are low-incoming groups, not rich people. And construction for all the communities done by government, medicine and all the other inputs is of government, service providers are of government, but management, it is of utmost importance, and it is done by the community itself. Each community having one committee group comprising of 9 to 13 members, and these members are representing the campaign area of each community, and look at youth members and other members from the different segments of the population of the campaign area, and the land donor is one of the vice chairpersons. And one thing I will mention that in this group, women empowerment is there, and because that is 4 of total members are female, and one president and 2 vice presidents. Out of 3 actually at least one is female. So because they are the policy level, they are the decision makers, and concerned UP chairman actually is the chief advisor for all the committees of the concerned union. And you know that our government actually went, they were in power in previous time. In 1998, actually this concept came, and they established this community unit. And from 1999 to 2001, more than 10,000 communities were established. But approximately 8,000 started functioning. But very sorry to say, this pro-people program were closed in 2001, like that of infant and death. And after it, more than 7 years closure and abandonment, economic is revitalized with the power of taking the responsibility of the present government under one project, the repackages of community healthcare institute in Bangladesh, and it is being implemented with contribution of all of us, all of you. And since that actually community started functioning in places, and at present 12,258 communities are functioning. It is more than 90%. So more than 90% of the target already been achieved. So this is increase actually community clinic hub going on.
Medical college in clinical subject, pediatric surgery. So as initial what I understand from Borinder that government wanted to give the primary health care to the doorstep of the people. So for every 6,000 people we have one community clinic, and they are providing basically primary health care. So they are reducing the burden of clinical patients to us. Thank you very much, Borinder. So now I will request our panelist, Shahnaz Bundi. She has visited, I think, one or two community clinics, so she will visit her experience with us. And our aim of this discussion that for Digital Bangladesh, our health ministry has a health management information system. And many health complex we have laptops, e-medicine. So through this MIS, how we can improve we can get the information of that community clinic, local people, and we can have a strategic plan to serve them better. So now I request Shahnaz Bundi to share her experience of visiting community clinic or if she has any suggestions.
And good morning, everybody. As we know from the Borinder that establishment of community clinic in 1998 was a significant sector-wide reform in the health sector of Bangladesh, which was revitalized in 2009 with a vision to provide primary health care service to 6,000 population per community clinic. The proposed number of community clinics is 18,000, of which 13,500 yet to be constructed, and remaining 4,500 to be established in the existing union and local level health and family care facilities. According to government, the community clinic should be the focal point for rendering health care to the majority of population who in general live in rural areas with little or no health care access. And government said more than 60 million people have so far taken services from the community clinic since its inception in the last decade. Also, the clinics are built with an aim to provide primary health care and ensure proper referral of patients in rural Bangladesh. As a journalist, I had the opportunity to visit some of the community clinics in various districts for free hours. So what I found there is that many of the poor rural people came there frequently, and there was an health assistant, male health assistant there, and the family planning assistant for give them the service in many places. And mainly the women and children came there to take the service. Because as we know that women and children are the more vulnerable part in our society. I talked to some of the people and they complained, they come to the doctor and they complain for fever, cough and skin diseases. There are also some pregnant women there. They mainly came with some difficulties like feeling weak or feeling bad or like that. And the health provider gives them the service. The main thing is the health provider are not in every day in the clinic. They have many other duties others who came there, and so they came 3 or 2 days in it or 4 days in it. And we all know the expectation of the common people of rural Bangladesh is very limited. And they came there for their limited expectations. But what they get from the community clinic, that is our question as a journalist. Yes, there is an infrastructure there, but only infrastructure or two-room building service in general in terms of quality is not very high. And what I think we must need to improve the quality of the service by training or providing the trained people or maybe paramedics will serve there better, I think. And we have seen many places where the NGO runs the community clinic and sometimes they can provide the good services. In Bangladesh, Plan Bangladesh and Eminence are working with the community clinic, and I think it will be a good example for private public partnership which the government wants to provide now. And in many places, in NGO, the clinic which was run by NGOs, the implementation team and project management unit visit the project areas and time to time to ensure improved accountability and in-place services. Some NGOs intend to strengthen the service, such as essential service delivery packages, including ANC, safe delivery and PNC, and referring the mother to nearest health facility, including NCWC in case of emergency and complications. I think these things we need to do more. And also we need to revitalize the rural health clinics, so proper monitoring and planned assistance from the ministry. I don't know if there is a strong guideline there or not. If the answer is no, then I recommend for a strict guideline for the health workers. They need a guideline not to prescribe any drug at will or based on their experience, because sometimes media reports show that the health workers are trying to make extra income, so private practices there.
Yes, we have our additional Director General, Professor Abul Kalam Azad, actually who has developed our health management information system.
One of the popular news reporters in Bangladesh. So I appreciate that you mentioned about the importance of health information system and giving information technology to the community clinic. So here I see also the project director of community clinic. Actually, we like to see the community clinic. Actually, this is not a clinic virtually. This is actually a place in the community which will play a role to improve the health of the community as a whole, not only to give the services to the people who will visit the community clinic. And we like to see the information technology actually to contribute to improving the health in the community. So how we like to see it. So that's at the beginning I like to give some information on the program, right? So currently we have got a little over 12,000 community clinics are functioning, and we have the plan that maybe by 1 or 2 years there will be 80,000 community clinics will be functioning. And actually we have it in our hand by this time 3,500 laptops with internet connection, and maybe in 1 to 2 months we'll distribute these laptops. And we have by this year actually we'll procure another 12,600 laptops with internet connection. And that means by maybe next August or September, all the functioning community clinics of Bangladesh will have a laptop and a internet connection.
So it makes you to say a few words regarding this issue on community clinics and especially in the cafe. This is actually role of information and what information could do in this regard. So unfortunately, I don't have any written skill. I would like to say openly, as I achieved my experience in my professional life. So first of all, I would like to say what information could do in the field. So far my understanding, information is one of the important phenomena like other development paradigms in the health sector, especially in the communication. So communication could play a vital role to make it in a position. And information is a very, I would like to say, a very good component in the field. So I have visited a district, this is Molil Bazar, to see what is the role of the community clinic there. So I have seen the community clinics are doing very, good way to provide Medicare services to the commoners. And there is a union, I don't know, actually I'm not mentioning right now the name of the union. There are so many community clinics. All the people, I would like to say, the people of this territory, they are under a common umbrella of the community clinic. I would like to say, the people of the, grassroots people, they are getting medical services, they are getting medicine, and they are getting as well as, the consultation from the community clinic. As well as I have visited some community clinics in Malaysia. There was an invitation by APSM to attend in a conference in Malaysia. APSM means Association of Private Hospitals Malaysia. So they have set a lot of community clinics in the rural area of Malaysia. So I have seen that community clinic is actually, it is not needed from the, central network of Malaysia. It is very much integrated with APHM central network of Kuala Lumpur. So what Kuala Lumpur hospitals they are providing the support to the patients and the common people in Malaysia cities, as well as same service they are providing to the commoners in the rural area. But basic difference is that in the city Kuala Lumpur, they are getting, a good hospital atmosphere. In the rural area, they are getting same services, but they are not. It is a very simple. I would like to say, ordinary hospitals and ordinary, medicine shops and medicine, umbrella there, but services same. But what I have seen, the difference between here in Bangladesh and the Malaysia, that is, I would like to say, the Malaysian people, they are getting good information from the, central Malaysian government. And we don't have any, integrated information providing system. So if we would able to provide information network properly and effectively for the commoner, I think we'll get more benefited from this. Integrated of all, people from all walks of life, of the grassroots people. That is important. Registration is part. Then we have to provide need-based Medicare services. Need-based Medicare services means some people they need, child Medicare services. Third, information distribution system must be provided. Without having proper information distribution service, we cannot provide healthcare services to the people. That is important. And feedback is very much required. I think in Bangladesh especially, feedback is mostly, negligible part. If we don't have feedback, then we are not getting what is the aftermath of treatment, what is the, post-treatment situation, and what to be provided the services, after services. So, after the analysis and I would like to say the investigation in the field of community clinic. So I would like to suggest some services should be provided. One is in terms of connectivity. As we told earlier, the government of Bangladesh is actively working to provide internet connectivity to provide all the community clinics, and as per my knowledge, so far more than 2,000 community clinics are under the internet services right now, if I am not wrong. And a database system of community clinics. Database system means database system should be established containing the area name, area network, total people, the people's all the information, then need-based treatment, doctors' availability, medicine availability, local hospitals' name, phone number, etc. A database system, it could be a local database system, it could be a central database system. So establishing a database system is very much required here. And cable TV system. As we know, nowadays cable TV is available in the rural area also, as well as in the urban area. So we will see there is a video channel there. So we could utilize the video channel to make the aware people regarding this issue. Then we could play, we could telecast some documentaries, we could telecast some information using or utilizing the cable TV in your area. That could be one of the important, tools to aware the people.
Business Trustee also mentioned to advertise whether we need community clinic or not, or whether we need channel TV promotion. That's very important, I think. So before going to our final speaker, I will request to have one very renowned personnel with us, Professor Dr. Shamuntullah Sheikh. So I want to request that if you have this opportunity of MIS and community clinic, what will be your message? How you can improve bird management through this, just to share.
What I must say that in Bangladesh, that we can stop the bird injury if we can create the awareness for the prevention of bird in Bangladesh, because in our hospital, 80% of the bird patients are due to the lack of water. So community clinic can serve a very important role through media and everything to aware the people not to be involved in the bird injury. But I will say much more details tomorrow in my presentation. Thank you very much.
Any suggestion how we could go forward with these two projects? And preparing two sessions will be here after this session, and one is going in the other room.
Actually, community health, a field of public health. Community health is a discipline which concerns itself with the study and improvement of the health characteristics of biological community. In our country, I think it was initiated by certain Awami League government led by Prime Minister. They first took an initiative to construct a thing community health clinic to provide primary